By now, we've all heard about the Senate's historic reform plan. This reform plan deals with health care. It saves lives, it saves money, and it saves Medicare. And you've heard how it'll do each of these things by guaranteeing affordable care for every American, slashing the deficit, and rebuilding our economy. So you've also probably heard about where we're going. I want to take just a moment to appreciate just how far we've come. This bill is not just a milestone along a journey of a few months or even a few years. We've been working to reform health care since the first half of the last century. As the Senate heads down this home stretch, I'm going to read just a short piece from a long letter by a former senator about the urgency of action on health care. This man wrote to Congress, and I quote, "Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them attain the opportunity and that protection." He went on to write, this former senator, "People with low or moderate incomes do not get the same medical attention as those with high incomes. The poor have more sickness, but they get less medical care." He went on to say, "We should resolve now that the health of this nation is a national concern, that financial barriers in the way of attaining health shall be removed. That is, the health of all of its citizens deserve the help of all the nation." Again, the health of all of its citizens deserve the help of all the nation. That former senator was Harry Truman. And he wrote that letter to Congress on November 19th, 1945, just months into his presidency and exactly 64 years ago today. He knew that the health of the American people is linked to the health of the American economy. Way back then he knew that. But since President Truman demanded that we make it easier for every American to afford a healthy life, we've only added millions more to the number who cannot have health insurance and don't have health insurance, and only added billions more to our deficit. This is how long we've waited. A man or woman who turned 1 year old the day Truman issued his call to action, but who has lived his or her entire life without the ability to afford health care as it got more expensive each year, would just today, November 19th, become eligible for Medicare. Generation after generation has called on us to fix this broken system, and we're now closer than ever to getting it done. What we do in the next few weeks will ensure that in the coming months, insurance companies will not be able to deny health care to people who are sick. It will ensure that in the coming years, families will not have to choose between their mortgages or their medicine. It will ensure that in the coming decades, we'll leave our children a better inheritance than a deep deficit and a broken healthcare system. And it will ensure that 64 years from today, future senators will read about this generation's call to action, not with an apology, but with appreciation that we chose to be on the right side of history. We're going to hear now from a partner I've had in this for the last many months, Senator Chris Dodd. Well, no.
Hey, bravo.
Thanks. Thanks. Well, first of all, let me begin by thanking Majority Leader Reid. Moments like this don't happen accidentally or miraculously. They happen because you have a leader that does not bow, does not back up, but plows forward, even during the difficult weeks and months we've gone through over the past year or so as we've tried to formulate this package that we presented last evening. And so every American, whether you agree or disagree with every provision in this proposal, owes a deep debt of gratitude to the senator from Nevada, Harry Reid. Couldn't have without it.
Hey, Harry! Hip, hip, Harry! Woo! Woo!
As all of you know, I'm somewhat of an accidental participant in all of this. There should be someone else standing here this afternoon by the name of Ted Kennedy. who was the one who championed this, besides Harry Truman. I think Ted Kennedy was the strongest advocate for health care reform that this country has seen in the last century or so. And so I want to acknowledge him and thank him, as we all do, every single day, as every American ought to, for his tireless efforts. And assuming the responsibility, along with Tom Harkin and Patty Murray and Jeff Bingaman and so many others in our committee over the last number of months, concluding on July 15th, of putting together the Help Committee proposal, half of this equation that has resulted in the bill that the leader has now announced. I'm sorry that Max Baucus isn't here, my good friend and colleague, who, as many of you know, his mother is ill and he's in Montana with her. But Max Baucus and the members of the Finance Committee, people like Chuck Schumer, who's here, and so many others, played such a critical role in bringing that to pass. So we thank Max for his efforts. But this is an opportunity that comes oh so rarely to any Congress to make a difference for 100% of your fellow citizens. On law bills on the past, others we deal with fractions of the population, important issues. I don't minimize them. But in this proposal, we will improve the quality of life of every single American for literally decades and decades to come by increasing that access, reducing cost, and improving the quality of health care for all Americans. For the first time, we're going to allow the American consumers to be involved in a buyer's market when it comes to insurance, not a seller's market here, where the insurance industry decides what's going to happen here. For the first time, we're going to say to seniors, you are going to get the kind of protections not only with Medicare, but also older Americans who haven't reached that magical age that I have, of 65, but still feel we'd like to have that kind of health care that you need. To see to it you're going to have the quality of care, the benefits available to you, to see to it that you have the protections you deserve as Americans. For those who have health insurance and have never had to use it, we want you to know it's going to be stable. It's going to be there when that moment does arrive, as it does for every American family, when you have to access this system and discover it isn't quite what you thought it was. We provide the stability and assurance that those medical opportunities are going to be there for you. And for the millions of our fellow citizens who, through no fault of their own, but the circumstance of birth, the circumstance of economic circumstance, are today going to get health insurance and coverage in America. Never again will American citizens be denied the opportunity to have the kind of health care they deserve. And that's important to all of us. So there are many things that will happen instantaneously in this bill, doing away with the kind of discrimination that's occurred on the basis of gender and age. No more having arbitrary limits on coverage, new protections against going bankrupt because of health care costs, and no more insurance companies dropping your coverage because you get sick. Now, there are those who advocate the status quo, and I'll be brief on this point, but I think it's very important. Obviously, the individual circumstances that are improved by health care, you're going to hear a great deal about. But there are those who are advocating that we should wait to another day, put this off. It's too controversial. It's too complicated. Well, obviously, the answer to that is a resounding no, but there's a reason why we should say no, beyond the human elements that are so critically important in all of this. If we allow this situation to stagger further, the problem only becomes more difficult and much harder to resolve. None of us want to see premiums double, as they will in the next 7 years, for $12,000 for a family of four to $24,000 if we do nothing. That's the status quo. 3.5 million jobs could be lost in our country. Bankruptcies increase. Foreclosures of homes. The status quo is unacceptable. This Congress, this presidency are going to sign into law a national health care program for all Americans. That's why we're here. We need your support in backing of this.
Good job, Chris. We're going to have more things like that.
Dodd's a hard act to follow. Well, this is truly a historic and pivotal moment in this long march. At long last, we have this strong merge bill with a strong public option to take to the floor of the United States Senate. This last weekend, I was on a little train ride, and when you go on a train ride, you pick up something to read, and there was a book on my credenza that had been there for some time. I really hadn't read it, but I picked it up, took it with me, and I read it. It's a book by Harry Reid. It's called The Good Fight. And it's sort of his life story and all the good fights he'd been in, sticking up for people and underprivileged and fighting for people that didn't have much and trying to advance our country. Well, Harry, you're going to have to get a new edition of this book and add a new chapter, because this is another good fight that you're leading for us here. And I'm sure glad you had that letter from Harry Truman on November the 19th of 1945. I knew that was an important day. That was my 6th birthday. I remember it well. I said at that time, I'm going to be here and I'm going to help carry Harry Truman's dream forward. I said that.
Happy birthday.
6 years of age. But, God,
I'm not going to sing happy birthday.
no, I hope not. But I truly do want to thank Senator Reed for his patience and his great leadership on this. What a great story there is to tell about what he did to bring us to this moment. And also for Chris Dodd, who led our committee during these trying times, keeping in constant contact with Senator Kennedy and getting our help bill through the committee. We couldn't have asked for a better leader, and as you can tell, for a more inspirational leader than Senator Chris Dodd. And to Senator Murray, who we worked with to get our bill through, the Help Committee, Senator Schumer, Senator Durbin, always there, all pulling together to get us to this point. So I salute all Democrats and Republicans who helped us get here. But I got to tell you something. This bill, not only is it fully paid for, it actually reduces the deficit. And so now, after all this sort of chaff that's been out there, now we get to the substance of the bill. And on that score, I'm very confident that not only will the Democratic caucus unite around this bill, but the American people will unite around it also. I mean, what's not to like? We extend insurance coverage to almost all Americans. 94% will be covered. Provide subsidies for those that can't afford it. It will ban insurance company abuses, such as denying people for pre-existing conditions, dropping policyholders who get sick. It helps young people find better coverage, keeps them on their parents' plan until age 26. As I said earlier, it includes a strong public option to give more competition out there. It helps families make more informed decisions on prevention and wellness, and that's something that hasn't gotten a lot of attention, but it's something I've worked very hard on. This bill has a huge thing in there to move us more for prevention and wellness, to keep people healthy in the first place and keep them out of the hospital. No co-pays, no deductibles for certain preventative measures. Well, our aim here is very simple: to recreate America as a wellness society, to get away from sick care to true health care. So again, the way is clear. As I've said before here, we've got this bill. It's all paid for. It covers all Americans, makes health care more affordable, reduces the deficit. Well, I guess as an old-line Democrat, here's what I got to say about that. We had the New Deal, we had the Fair Deal, and this is a good deal for the American people. Thank you.
We believe it's important that you hear from someone who's not an elected official, but someone who's down there that has experience in the real world. Loretta Johnson. Loretta Johnson's 62 years old. She's going to tell us a little bit about some of the problems she's had with health care. Loretta?
Thank you so much, Senator Reed, and I'm honored to be here today. My husband had open heart surgery, was a diabetic, and he had a pacemaker. And when he became so sick in the year 2000, I decided to quit my job and stay home to take care of him. With quitting my job, I lost my health coverage. And after he passed away, I became a healthcare worker, which means I'm at the bedside taking care of sick people every day, and I do not have health insurance. That is why I'm so proud to be standing here today representing SEIU and its 2.1 million workers. because after more than 100 years of debate, Senator Reid has said enough. Enough scare tactics and enough politics as usual. So the Senator's Patient Protection and Affordable Care Act puts us one step closer to the health care that every American needs. Because of his leadership, insurance companies will no longer control our health care system, making sure people like me actually have the health care we need. Now, in my opinion, there's probably some room for improvement in this bill, but I know that Senator Reid and all of the senators standing here with me today are committed, as we are, to making sure people can afford the care they need. And believe me, I will continue to be here on the Hill to make sure that each one of the senators do the right thing. Thank you.
Thank you, Loretta. Very nice. Very nice.
Thank you, Loretta Johnson. I am partial to ladies named Loretta. Let me just say at the outset that Harry Reid had to fight great political forces and the Senate rules to bring us to this moment, and the fight continues. We are proud of his leadership, and we thank Senators Dodd and Harkin and Baucus and all the members of the committee that helped to bring us to this moment. Last night I issued a challenge to the Republican side. We posted our health care reform on the internet for everyone to read, for the whole world to read every provision, every word, and to understand our goals. I challenged Mitch McConnell and the Senate Republicans to produce a health care bill that will save us $127 billion in the deficit over the next 10 years, and there's nothing posted on the internet. I challenged Mitch McConnell to come up with a bill that makes sure that 94% of Americans have the peace of mind of health insurance coverage, but the Republicans put nothing on the internet. I asked him to come up with a bill that would give us sound financial footing for Medicare, reducing the increase in health care costs, giving seniors a helping hand when it comes to Medicare prescription drugs, providing the basic wellness and exams that they need to stay healthy, but not one word from the Republican side of the aisle. The list goes on. I've yet to hear the first Republican senator even stand up and take on the insurance companies. That might tell you something. The fact is that we understand that the American people need a fighting chance when it comes to these insurance companies. You know what happens. When you need that insurance the most, they turn you down. Pre-existing condition, caps on coverage, no, that your son's 24 years old, we're not going to cover him now. We address every single one of those in terms of fairness and equity. So I listened this morning as the Republicans came to the floor. I thought, well, what will they have to say? The leading criticism about this bill is that it's 2,000 pages long. 2,000 pages long, as if we don't have big bills before the Senate and the House. We do all the time. And this one addresses major issues, 1/6 of our economy, and also takes on the health insurance companies. You better make sure you have a lot of pages there to cover the lawsuits they're going to file to try to stop us. And I might remind the Republican side of the aisle, when it comes to the size of legislation, it was that bank bailout bill that the last president proposed that was only 3 pages long. Now, there's a work of wisdom. So I would just say, went home last night, and Chris Dodd had made reference to Ted Kennedy during the course of our great caucus when we came together, and I picked up that book, True Compass, and started reading again about Ted's battles, going back for years on health care. I too wish he were here. I try to imagine what it'd be like. I try to imagine what it was like to be at a gathering like this when Franklin Roosevelt finally passed Social Security, when Lyndon Johnson passed Medicare. What a momentous historic day that literally changed the lives of millions. Well, we've come on a long journey here, but we've come so far we are not turning back. We are not turning our back on the people who are counting on us to get this bill through. The millions of Americans who know that we have to finish this job and finish it right so there is quality, accessible, affordable health care for every single American. Loretta, your situation is a situation repeated across the state of Illinois and your state of Virginia and every state in this nation. It is time for us to stand together and pass health care reform.
Thank you.
I want to thank all of my colleagues here today. I do want to mention, as the member of the Finance Committee who was here, Senator Max Baucus. He worked so long and so hard. And it's unfortunate he couldn't be here with us today in person, but he's with us in spirit, and he'll be back in person. And I am sure he will be behind the President as the President signs national health care into law, and he'll deserve a heck of a lot of credit for that. Senator Baucus, thanks for the great job you did. Of course, Senators Dodd and Harkin, that great team on the Help Committee, and the impresario, the great chef, Harry Reid. I have this tie on here. It has eggs and cheese and pork. So it's a great omelet. Harry made a great omelet. You sometimes have to break a few eggs to make a great omelet, but he did. He's a great chef. The cheese came, we had very good cheese from the Finance Committee and pork from the Help Committee, Tom. I couldn't say pork from the Finance Committee or I'd be in trouble. But in any case, this is really a good bill, a really good bill, an outstanding bill. Who would have ever thought we could cover 94% of the people, save Medicare and private insurance, which were going broke, eliminate waste, fraud, and duplication, and at the same time cut more costs, unnecessary costs, from the federal budget, $503 billion, than any bill has ever done, and reduce the deficit by $127 billion. It's an incredible work. And the momentum has now shifted to us. All the naysayers, those 2,000 pages, each one will represent hundreds of people who get coverage, hundreds of people who will keep Medicare, hundreds of people who will keep their private insurance. Those pages push the momentum in our direction because people see what the bill does. All the fears and all the negativity are sort of blown away by those words. And it is humbling to be here. We're not there yet, but we are in the territory that's very close to getting over the goal line. We are in the Republican territory now, and we're marching forward. And so I just want to say that this has been long overdue, and it's what we've been able to do so far and will continue to do until the President signs that bill into law. This is what we should be doing here. This is why we're senators. This is why we're legislators, to help our constituency despite all the obstacles thrown in our path. We will succeed. There will be a bill signed into law that America and all of you can be proud of.
It has been a long journey, one that is not over yet, but I am so excited to stand here today as we move closer than ever to passing an historic bill that will finally reform our broken healthcare system and help millions of our families and small businesses get the coverage they need at a price they can afford. It is about time. For too long, we've had a health insurance system that crushes our hardworking families under the burden of the skyrocketing costs that they're seeing. And for too long, we've had a health insurance system that devastates small business owners and penalizes our best doctors and hospitals. I have heard from so many passionate constituents over the last few months. I heard from a woman by the name of Patricia Jackson. She lives in Woodinville, Washington, a small town in my state. She sent me a story that I wanted to share with you because, like many working families, the Jacksons have private insurance through their employer, and they pay their premiums directly out of her paycheck. But like a lot of families, the burden of those premium payments is rising way too high. To provide for her family of four, Patricia told me she paid $840 a month in 2007. 2008, went to $900 a month. This year, it went to $1,186 a month, and before this year is over, she just got a new bill, $1,400 a month.
Whoa.
That is an increase of over 66% in just 3 years. Patricia told me she and her family, like many others, cannot afford that and they're not alone. These skyrocketing costs are really weighing on all of our families and all of our businesses. We are here to make sure that changes. That here in America, losing your job won't mean you lose your health care. That here in America, families will be able to know they're secure because their health care premiums are not rising at 66%. And that here in America, insurance companies will no longer be allowed to reject people because of a pre-existing condition or cut off their coverage. And finally, they will be forced to compete for the business of American people. Now, some of my Republican colleagues don't think this is an urgent problem. They don't think our country needs real reform. They tell us we should wait. They aim to do a lot of cheap political tricks just to delay us debating this and getting to reform. I want to ask, who do they think they're hurting? Not those of us standing here. It's the families out there with sick husbands and wives and kids, businesses who are hurting, who can't afford to cover their employees, and people who have coverage but are worried about losing it. That's who they're hurting. Those are the people we're fighting for. So I got to tell you, as a mom, as a senator, I say enough is enough. Enough with the politics, enough with the games. This issue is far too important. So I call on all of our colleagues to step across the aisle and work with us to rise above partisanship. We have a good plan. It's going to rein in costs for our families and our small business owners. It's going to make sure that every American has high quality, affordable coverage. You know, these problems in the health insurance for all of us are not going to go away. There is no time to wait. We are going to get to work. These costs are rising at an unsustainable rate. We've been talking about reform long before Senator Harkin was born. And happy birthday, Senator Harkin. We have a good plan. It's time to go to work. I am so proud to be fighting in the trenches with the people you see standing before us. We're fighting on the side of right. We're going to get this done. Thank you.